Good day, class. My name is Oluremi Olurantilonge, and I'm going to be taking us on TAU NSC 520, Geriatrics and Home Care Nursing. Geriatrics and Home Care Nursing. By way of introduction, aging is part of a life course continuum, and its beginning is not clearly demarcated at any one specific point in time, and there is a great deal of individual variation among people regarded as elderly. Aging does not start at any one chronological point. Instead, it is the accumulation of some common characteristics with increasing age that help to identify an elderly. Illness tends to accumulate with increased age. Legally, an elderly person is a person of 65 years of age or above. The age of 65 is used not because of the actual physiological, psychological, or sociological changes, but because it is the age of retirement in most of the countries of the world. Aging is a developmental stage, and like any other developmental stage, is a linear process. Aging is a normal process of time-related change, begins with birth and continues throughout life. Normally, it is a process of getting older. Aging is defined as a progressive, unfavorable loss of adaptation and a decreasing expectation loss of life with the passage of time that is expressed in measurements as the great viability and vulnerability of normal forces of mortality. Types of aging. There are 4 identified types of aging. They are 1. Biological aging. This refers to changes in structure and functions of the body that occurs over lifespan. This includes all the changes that occur in individuals due to biological activities of the cells, the tissues, the organs, and the system in the body over the lifespan. Functional aging. This refers to the capacities of individuals to function in the society when compared with those of others of the same age. Here, the productivity is used to define the age of an individual. It is the society that determines whether one is an elderly or not. Psychological aging. Psychological aging refers to behavioral changes, oscillation in self-perception, and reactions to the biological changes that occur in the body of the individual over time. In this case, it is the attitude of the individual that determines his or her age. This gives rise to youth at heart. Sociological aging. This refers to the roles and the social habits of the individual within the society. This definition is closely related to functional aging. Theories of aging. Several theories of aging have been identified, and these are the lists, but they are not limited to this alone. One is Erik Erikson theory of developmental stages, Havinger's theory of development, activity theory by Havingers and Halbrecht, 1953, continuity theory, disengagement theory, cross-link theory. Implications for nursing. Understanding theories of aging can assist healthcare providers in supporting their clients. For example, the psychosocial theories help to describe the developmental tasks and challenges older adults face and the importance of finding and accepting meanings in one's life. These theories recommend that social support systems, activity and role engagement support healthy aging and suggest that societal expectations can influence adjustments to aging and life satisfaction. Healthcare providers can learn from these theories to help minimize changes of aging by connecting older adults to resources. Health challenges and disease of older adults. What are the health challenges and diseases of older adults? Arthritis, heart disease, cancer, respiratory disease, Alzheimer's disease, osteoporosis, diabetes mellitus, influenza and pneumonia, depression, substance abuse, dementia, falls, obesity, etc. Geriatric nursing. Geriatric nursing is a field of nursing that specializes in the care of the elderly. Geriatric nursing is a specialty that focuses on health care of elderly people. It aims to promote health by preventing and treating diseases and disabilities in older adults. Gerontology nurses work in a variety of settings, including acute care hospitals, rehabilitation, nursing homes, assisted living facilities, retirement homes, and community health agencies and patients' homes. The American Nurses Association Standards of Geriatric Nursing Practice: assessment, diagnosis, outcome identification, planning, implementation, evaluation, research, resource utilization. Principles of home care nursing foundations. Home health services are those which are provided within the comfort of the home setting to help people avoid hospitalization or skilled nursing facility placements while they recover from illness, injury, or disability. There are 5 principles. They are: 1. Safety, dignity, independence, privacy, and communication. Palliative and end-of-life care. Palliative care is specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. It also can help the individual to cope with side effects from medical treatments. The availability of palliative care does not depend on whether the condition can be cured. The National Hospice and Palliative Care Organization, the NHPCO, states that end-of-life care or hospice care commences when a person has a diagnosis of a terminal illness with less than 6 months to live, and curative treatments are no longer options. In conclusion, geriatric nursing involves a field of nursing concerned with improving and maintaining the health of older patients. Nurses who specialize in this field undergo specific education that teaches them how to care for older adult patients and understand their specific health needs. These nurses are also known as gerontological nurses. This is the reference for this course resource material. At this point, I would like to implore students to avail themselves the opportunity of going through this resource, accessing this resource materials and going through it, and they should endeavor to read the notes herein for better understanding. Thank you for listening. See you next class.